On this episode, we're going to talk about hyperbaric oxygen therapy, which really means saturating your body with a lot of oxygen. And it really has some very good anti-aging as well as health optimization benefits. So stay tuned. Dr. Scott Sherr is the Director of Integrative Hyperbaric Medicine and Health Optimization at Hyperbaric Medical Solutions. In this role, he facilitates protocol development, patient engagement, and outreach efforts. Dr. Scott is also an independent provider of integrative hyperbaric oxygen therapy who runs a worldwide education, consulting, and advocacy telemedicine practice. He's one of the few hyperbaric oxygen therapy medical professionals in the country who develops personalized treatment plans for patients. Hello, everybody. Today, I have a very interesting guest. His name is Dr. Scott Sherr. He's an expert at hyperbaric oxygen therapy, and I am excited to have him here because that has been linked to some acute conditions, but also with anti-aging in general, as well as health optimization. So, Dr. Sherr, welcome to the Anti-Aging Hacks Show.
Thanks for having me, Faraz.
So let's start off with getting into your background and how you got into hyperbaric oxygen to begin with.
All right, the quick story is that I grew up pretty alternatively. My father's a chiropractor, grew up in New York. And so I grew up in his office doing crazy things, watching him do crazy things. And they weren't crazy per se, but they were not sort of what your normal your chiropractic doctor would be typically doing. He'd be changing people's diets. He'd be doing things on the sort of manual side as well, but it was a very holistic perspective that he had. And so I grew up in the waiting room. I grew up collecting money at the office when I was in high school, and that was my spending money when I was in high school, and I was really good at actually collecting money at the office. And I went to medical school, though, after going through college and talking to him and really understanding that there was a lot out there that he couldn't do that was sort of separate from the chiropractic sphere. And alternative medicine at the time when I grew up was very separate from conventional medicine. There really was no integrative medicine. There was really no functional medicine available. And so I thought that I could have this high-minded idea where I could kind of bring these things together in some way. I got into hyperbaric medicine in that frame in a strange way. I was in medical school. I trained at a trauma center where they had a large hyperbaric facility in the basement. They were using it for things like flesh-eating bacteria and carbon monoxide poisoning, soft tissue injuries, trauma. And I saw this amazing technology do amazing things to people. And it was such a simple technology that I was kind of at an epiphany at the time, even though I was really, really tired after being a medical school resident and being on call every 30 hours, every 3 nights, actually, during this rotation at shock trauma in Baltimore. And I did some research and I saw how simple the technology was and how universal the technology really was when it came to healing. And that's really got my interest picked. And I decided that I really wanted to pursue it after I finished all my training multiple years later when I moved out to California in 2012. And that's when I kind of delved really deeply into hyperbaric medicine. I had a great mentor, a lady that I work with, actually. She's a certified hyperbaric nurse at the facility that I became medical director of. And I really got to understand an integrative perspective of hyperbaric medicine. And over the last 8 or 10 years now, I've really developed a practice around the technology and not just the technology itself as being the main driver of what I do, but it is sort of my ultimate biohack expertise, whatever you want to call it, but it ends up being maybe 20% of what I typically talk about with most people. So
Okay.
But that's the short story.
Okay, got it. So then let's talk about hyperbaric oxygen or why we need it. Obviously, or not obviously for some people, we have a blood oxygen saturation normally, I think 97% or higher. Mm-hmm. So why do we need to increase the oxygen in our blood even more?
That's a good question. Yeah. So what we're doing in a hyperbaric chamber is we're increasing the amount of oxygen that you breathe, and we're increasing the amount of atmospheric pressure that your body is under. Now, typically, like you said, 21% oxygen is in the air that we breathe now, and that saturates about 97 to 100% of the sites where oxygen typically saturates in the blood. And that's actually on your hemoglobin molecules, which are on your red blood cells. The amount of oxygen that you carry is called your oxygen carrying capacity. And so there's a limited amount of oxygen you can carry on your hemoglobin. Typically, most of us at 21% oxygen in the air are doing as much as we almost can. 97 to 100%. And so when you measure a pulse oximeter, which is the thing you put on your finger, that's what's measuring your arterial hemoglobin oxygen concentration. So that's how much hemoglobin is bound to oxygen in your bloodstream. Now, there is a significant amount more oxygen you can get into circulation, but it's not going to be on your red blood cells unless you're doing one of two things. You can increase the number of red blood cells in circulation. You can do that by altitude training, hypoxic training, or you can do it illegally by using a drug or hormone called epogen. And this is what all the cyclists like Lance Armstrong got caught doing or not caught doing, but eventually had to go on Oprah and admit it that they had to do or did to get their leg up on their races. But the other way to increase oxygen carrying capacity is actually to diffuse more oxygen into the plasma or the liquid of the blood. And the liquid of the blood has very little oxygen in it at sea level. And it's the pressure that we put on a chamber. It simulates the pressure you would feel under a certain amount of seawater that really drives that oxygen into the bloodstream, into the plasma. And it's that oxygen, that increased amount of oxygen, that changes how the body does almost everything. It does it initially by infusing a lot more oxygen in circulation and delivering more oxygen to tissue. And it's that delivery of oxygen to tissue that allows tissue to stay alive, potentially if there's been an acute condition, if there's been acute trauma, heart attack, stroke, traumatic brain injury, acute spinal cord injury. If you get more oxygen to cells, you are providing those cells the oxygen they need to still maintain their energy production. Because as most of your listeners probably know, oxygen is the final electron acceptor in the mitochondria on the electron transport chain. So that's where you're making energy. And so we're getting more oxygen to that tissue. And as a result of that, you can potentially maintain that oxygen need of that cell and then maintain the energy production capability. So in the acute setting, that's what's happening, along with some other things as well. You're also killing bugs because high oxygen environments are not conducive to bugs that do not like high oxygen environments. You're also increasing the amount of flow into tissue and flow out of tissue because of local forces related to the amount of structured water around cells and in the cytoplasm and in blood vessels. This is something called easy water, something that's been developed, the concept by a guy named Gerald Pollack at the University of Washington. You're also doing something called, you're also releasing stem cells as well, so a significant number of stem cells that allow the body to start the healing process. You're revving up the immune system with all this oxygen in circulation. And then over the long term, over an oxygen infusion protocol, what you're really doing with all this extra oxygen is that you're actually shifting epigenetics. You're shifting how various genes are being transcribed and expressed and suppressed related to this oxygen exposure. And most of those genes that are being increased or in expression are genes that are responsible for growth, like new blood vessels, new connective tissue, new nerves, new bone, all those kinds of things. All the stimulating cytokines and chemicals that need to be released are being expressed. The genes that make those proteins are being expressed more. And the things that are being suppressed are ones that are responsible for inflammation and for programmed cell death. And so you have this shift in epigenetics for healing and optimization and rebuilding of scaffolding, as I like to say, of tissue, as a result of this epigenetic shift, along with the initial exposure and this significant infusion of oxygen.
Wow, there's a lot you said there, and we're going to dive into some of those pieces. First of all, my first question to you is, okay, so we've got red blood cells. We could increase the capacity, as you said, altitude training or, doing some illegal drugs.
Doping. Yes.
Doping. But if that's not possible, then we're increasing, let's say we're using hyperbaric oxygen to increase oxygen in the plasma, which is not going on the red blood cell.
Right.
So it's going to be the liquid. And so that pushing it into the liquid is going to enhance delivery into remote tissue like the arterial tissue. Is that how it works?
Yeah, it'll push it everywhere, right? Because it's a diffusion gradient outside of a blood vessel. Mm-hmm. So the more oxygen you have inside of a blood vessel, the more oxygen is going to diffuse out. Simple. And the further it's going to go as well because of those diffusion gradients. And they've actually looked at something like micron depths of how much oxygen gets diffused depending on how much pressure and oxygen, how much hyperbaric treatment pressure you're getting, how much therapy, what your level of pressure is basically. And the more pressure you go, the deeper and the further the oxygen is going to diffuse into that tissue bed.
Oh, that's very interesting. So traditionally, though, or plasma isn't usually carrying oxygen, or is it?
Very little, very
Very
little
little.
at sea level. Yeah.
Okay.
The only place it's going to do that is in places where you can have hyperbaric environments without going into a chamber.
Hmm.
The one place that most people know is the Dead Sea, because the Dead Sea is 1,000 meters below the sea. Although you're not underwater, when you go there, that's the sea level. That's the sea level pressure, or the sea level level, whatever. It's 1,000 meters below the sea. So when you go there, you're in a hyperbaric environment. So that's the only place that I really know of that's below the sea that you can get sort of simulated a hyperbaric environment without being in a chamber.
Okay. So you mentioned some acute conditions like stroke, heart attack, where your blood is getting blocked and your tissue is at risk of dying. So
Sure.
obviously it's huge to get this oxygen pushed through into the tissue to keep that alive until you can open the blockages or improve your condition, whatever that may be. How does this apply in a hospital setting? Let's say you are treating somebody. Do you also supply them more oxygen while you're doing this or helping them out?
Sure, you get a combination of the increased atmospheric pressure, and then we typically increase the amount of oxygen from 21%, which is in the sea level air that all of us are breathing
Mhm.
for the most part, to 100% or up to 100%. And as a result of that, that's how you get that increased amount of oxygen stimulus, not only that you're breathing, but also that gets into the circulation as well in combination. So even if you just have sea level oxygen levels, like 21%, and you pressurize a tank to say 23 feet of seawater or so, that equivalent pressure, you're still going to drive more oxygen in circulation because of a law called Henry's law, which basically says the more pressure on a gas, the more of that gas is going to go into liquid form. So there's different types of chambers, and we can talk about that. But in the soft-sided or mild hyperbaric chambers, which go to 1.3 atmospheres pressure, which is the equivalent to about 23 feet of seawater, if you just have sea level air that you're pressurizing, you're going to get about 46% more oxygen in circulation. Now, if you had 100% oxygen at 1.3, you'd be getting 600% more oxygen in circulation. So it's a significant difference than 46%. But there's still a significant increased amount even with sea level oxygen levels. One thing I should mention too for us is that pulse oximeters only measure the amount of oxygen that's on your hemoglobin. So a pulse oximeter will not measure how much oxygen is in your plasma. And so it doesn't give you a good sense of how much oxygen is really in your system. The only way to do that is in more invasive ways, getting something called an arterial blood gas, for example, which actually measures your arterial oxygen concentration directly.
Gotcha. I've heard of several folks in this during these times of COVID talk about carrying an oxygen or a pulse oximeter with them, as
Mhm.
well as an oxygen concentrator, which it's not cheap either. But that's what they've been doing. How does hyperbaric oxygen therapy help us beat coronavirus, or at least prevent the onset of coronavirus?
Yeah, it's a good question. There's now, I think, six or as many as eight studies that are looking at hyperbaric therapy for acute COVID-19.
Mhm.
These are all because of two ways hyperbaric therapy works. The first way is, as we've already described it, it is significantly increasing the amount of oxygen in circulation. And it can do that by saturating the plasma, as we've described it. So as a result, they've used it experimentally in places in like Louisiana, New York, San Diego, Switzerland, France, Israel. They're all looking at hyperbaric therapy and if it could potentially prevent people from going on ventilators when they get very, very sick and start needing oxygen. And the initial reports have been very, very promising. And it's
Mhm.
really because we're basically allowing the body to get more oxygen when COVID-19 is not allowing the body to get oxygenated. And so we have another way of getting oxygen in the body. We can get it into the plasma at a significantly higher level. So very, very exciting. And the other second way that we think hyperbaric therapy is working in COVID-19 and in a lot of other capacities is by decreasing inflammation. It has this profound anti-inflammatory effect, and it does it almost immediately, and then it does it over the long term by these epigenetic changes that I was describing before in downregulating all these inflammatory cytokines like IL-1, IL-6, TNF alpha, and others. And those get downregulated pretty quickly in a chamber. So it's not happening the first treatment, but over like a course of 3, 5, 10 treatments, you are seeing preliminarily like hyperbaric therapy working like, or maybe as powerful as a steroid, for example. Now this hasn't been done these studies haven't been done, like the steroid equivalent hasn't been done in COVID-19. It's been done in inflammatory bowel disease, for example, Crohn's disease and ulcerative colitis, where it can be as potentially as powerful as a steroid to help these patients, like with UC and Crohn's, actually get into remission after drugs haven't worked. And there's some pretty interesting studies that have, actually just a recent study again that was published, but others that have been published on UC specifically in hyperbaric medicine, hyperbaric therapy being very helpful in actually getting people into remission. And so it's a profound anti-inflammatory. So potentially in COVID-19, preventing or mitigating at least that second week where the immune system gets revved up and you have that cytokine storm initiate. So very exciting. And from a prevention perspective, we have no idea. Other than I can say that prevention is a much more holistic view, in my opinion. It's not just about getting into a chamber. It's about what is your holistic understanding of your optimizing health status. Where are you on the spectrum? Wherever you are, there's probably a place where you can go to be more optimized. And so that's really my perspective with the chambers in an optimized perspective. That's more like the longevity and optimized anti-aging hacks and all those kinds of things that go in there with the chambers and combinations of other therapies and technologies and practitioners and et cetera. The final point on COVID-19 I would make, though, is that there is definitely some interest in my community on post-COVID syndrome and how hyperbaric therapy might work. Right now, it's all conjecture. I have heard of a couple of my colleagues using the chambers investigationally with significant benefit for people that have this post-COVID syndrome, which seems to be probably related to immune system activation and hypoxia-induced inflammation. So as a result of that, we think hyperbaric therapy can be helpful, but it's still pretty early in the process. But on the acute side, really what we're doing in the chambers is and I think it's probably good just to kind of give the 4 or 5 things that hyperbaric therapy really does, no matter what the case, whether it's it's sort of immediate thing or long-term, is reverse hypoxia, reverse low oxygen states. It does that immediately by getting all that oxygen in circulation. And over the long term, it actually creates new blood vessels in areas of injury or degeneration to sustain that blood flow and that nutrient flow to that tissue over the long term. Second thing it does is decrease inflammation and swelling. And so it does that in the short term. And then over the long term, it does that by downregulating all those cytokines that I discussed epigenetically. The third thing it does is release a lot of stem cells, and those stem cells can go anywhere they want to go to make any tissue that they need to make. And the fourth is to kill bugs, especially bugs that do not like high oxygen environments. We know bugs like bacterial things like Staph aureus, MRSA, Lyme disease, some of the anaerobic infections like the ones that cause flesh-eating bacteria, those do very well, or do not do very well. Hyperbaric therapy is a very significant and can be very helpful in those cases. And the fifth thing that it does is increase flow. And now it's actually simply related to pressure, we think, and how pressure on the blood vessels and lymphatics creates more flow. And that's related to what we believe is easy water that's being created.
Okay. So these benefits that you just listed seem really great. They seem like very suited to health optimization, anti-aging, longevity. Mm-hmm. So, and you also touched on that it takes more than one session to get some of these epigenetic markers turned on.
Right.
So
right.
So a person that's, looking to improve their overall health, optimize their health, what is your recommended protocol for hyperbaric oxygen therapy?
Well, my first recommendation is to not go into a chamber right away, most of the time, because often there's a lot of work that we can potentially do to optimize our health before we get into a chamber and then supercharge it. The idea is that we're creating a lot more energy when you go into a chamber. And as a result of that, we're also creating a lot of need for the vitamins, minerals, nutrients, and cofactors that are required to make energy. Mm-hmm. We're also creating oxidative stress when we're making all that energy. Oxidative stress are these reactive oxygen species that are created when you have oxygen in a system that needs to be there to create ATP or energy, but it also is there as signaling molecules and a lot of other related molecules to signaling molecules, enzymatic reactions, et cetera. But if you have too much of that, it can potentially be detrimental to the system if you don't have the ability to create an antioxidant reactivity or have a surge of antioxidant capacity once you have all that oxidative stress. And so if you go into a chamber too quickly, you could potentially put yourself at a deficit. And I talk about, like, if you have a bank and you have no money in it, but you're borrowing from it and no collateral, you're going to default at some point. Mm-hmm. It's like taking things out on credit, right? So at some point the credit's going to come due and you're going to crash. This is the same thing with nootropics and all that other fun biohacking technology that Faraz. In my opinion, and this is something that I kind of grew up understanding, but it didn't really have a framework for it until about 3 years ago, which is, what is the framework for health that really can optimize you from a data-centric, from a measured perspective, and then really be a foundation for all of your biohacking or hyperbaric therapy in my case. And this was developed by a colleague of mine. His name is Dr. Ted Achacoso, and Ted is one of these brilliant guys that can do anything. His IQ is greater than, I think, 12 standard deviations above the mean or something crazy. Wow. And so he's done a lot of things, but he retrained himself in anti-aging medicine about 15 years ago, and then created something called health optimization medicine, which is this framework that I now use in my own practice in San Francisco. And it's something that is, I feel, a framework that anybody can use when they're looking to have a framework for whatever they're doing from an optimizing perspective. And that's because you really need to know how your cells are working. You really need to know that your immune system is healthy, that you're not eating foods that are toxic, that your gut is optimized, that you're not toxic, you don't have a leaky gut, that you're getting good sleep, and that you're optimizing your circadian rhythms, and that you're understanding your environmental exposures and your evolutionary biology and the evolutionary perspective of how your biology works. And also your mitochondria and how they optimize and how they were evolutionarily part of us, and how they became part of us, and how they're really bacteria that crosstalk with our DNA and crosstalk directly with our bacteria in our gut. And all of this stuff is what we do and actually crosstalk with our brain directly as well. And this is the stuff that I do in my own practice now, which is look at this framework as my foundation and then build on top of it. Hyperbaric therapy is how I build. But then there's all the other fun biohacking things that you can do as well. But what is the framework? How are you understanding how this is going to be utilized for you? Whenever I give a lecture, 95% of people are taking supplements, but maybe 20% of those people are actually understanding their biochemistry and understanding what they actually need versus actually what they're taking. And so that's what I'm a proponent of, is taking a step back from all the fun, look at the squirrel, oh, this is fun. And then what's the foundation of all of this? And then doing things in a more methodical way. And that's what I do in my practice.
Okay. No, that sounds very legit. And I'm glad that you're bringing it back a little bit and setting a base for everything else, because I know a lot of biohackers that are trying 20 different things and not optimizing sleep. So how much of that 20 different things are they getting? Like, if they could optimize some of the base things, like the gut, yes, the sleep, mitochondria, making sure there's enough of them, and the vitamins and minerals, you'll go much further. So in terms of, a patient working with you or trying to figure out what their base, where they're at and what their understanding needs to be, what does that entail? Can you shed some more light before they step into a hyperbaric oxygen chamber?
Yeah, to say about hyperbaric therapy, though, it's a fantastic anti-aging tool. And we know this from the work that's been done mostly in Tel Aviv, Israel, at a hospital called Asaf Harafeh. And one of my colleagues, his name is Dr. Shai Efrati, and they have the largest hyperbaric facility in the world, treating over 200 patients a day and about 20% of those people on studies. And so they've shown that you can regrow blood vessels in your brain. You can regrow blood vessels and increase the density of blood vessels around your heart. And you can regrow blood vessels and increase the density in genital tissue in the penis. They have MRIs of the penis showing before and after studies of blood flow in the penis for erectile dysfunction and for increasing your VO2 max as an athlete because of increased vascularization around your heart. And then they have brain aging, beautiful pictures of how the brain can regrow blood vessels and optimize. But if you ask the Israelis or almost any of my hyperbaric colleagues, well, what if they're eating McDonald's every day and smoking, or sleeping terribly, or on 75 different medications? What's the maintenance? What's the sustainability of these changes? Nobody knows. But the secret is that nobody focuses on it. And because lifestyle change is difficult for people. It's like anything in conventional medicine. Pills and treatments are much easier for people to do than actual groundwork, frameworks as we're describing it. So what I do is say, you could get into a hyperbaric chamber, and do all the things that I just mentioned. I don't know how long they're going to last. I don't even know if they're going to happen for you if you're toxic. What I'd recommend instead is looking at blood, urine, and stool markers, and then creating a data set with that information. And then with that information, creating a health optimization medicine plan for you, a health management plan for you. It can go alongside your disease management plan if you have a disease, whatever, or a condition, whatever that may be. It could be anything from nothing to cancer. We can find a health management plan for you along that spectrum that includes these health management tools and these metrics as I've described. And then as that's going on, then you can start adding in other technologies, techniques, practices, hyperbaric therapy, practitioners, other things that may be helpful to really holistically optimize yourself in a sustainable way, not for just today, but for in perpetuity, for that idea of creating the best and most optimized health span we can, the fountain of youth kind of idea, not just living longer, but reversing our age, really is what we're hoping to do, or at least stabilize our age, depending on how old we are.
Okay, now that's great. Everybody wants to reverse their age, or look the same as they are for a long time. And so that's important. Now I want to touch on one thing you mentioned, which is the concept of vascularization and creating new blood vessels and new blood flow. So the question, I've been very interested in this field as of late. And my question to you is it, as we get older, I think my understanding is that we lose some of these blood vessels in the extremities, in the penis, as you mentioned, in the brain.
We do.
So is it a good idea, generally speaking, over, let's say, 40 years of age, to be using technologies that create angiogenesis, that create new blood vessels overall in your entire body? Is that fair?
I think the fair answer is yes, with just a small caveat. One of the questions that I get a lot, especially in patients that have had cancer or in patients that have had family members with cancer, is that there is some worry that you create more blood vessels, potentially you can help cancer grow. And the answer to that one is a little bit nuanced in the sense that hyperbaric therapy does not make cancer grow. And the reason for that is that we think most cancers are hypoxic or low oxygen. In fact, there was just a recent study that was published that the more hypoxic a tumor, the more oxygen starved it is. These tumors tend to grow very fast and outstrip their blood supplies. And so when they're starved of their blood supplies, they have a higher risk of metastasizing or spreading, the more hypoxic the tumor is, and the more treatment resistant it is as well. So what these researchers did was they flooded these tumors with oxygen, and they didn't metastasize. They didn't spread. They got a little bit bigger on that initial nidus of the tumor, but they didn't spread. And so that's a big deal, because if you have a tumor that's localized, that's curable, as opposed to something that's metastasized, which often, unfortunately, is not. But from a longevity optimization perspective, to go back to that, once you reach about 50 years old or so, if you get an MRI of your brain, and what it's going to show is what are called microvascular ischemic changes. These are your small blood vessels, capillaries in your brain dying or degenerating over time. And if you have grandma who's 85 years old who can't remember what she ate for breakfast, this is something called senile dementia, which is not Alzheimer's dementia. This is senile dementia, where you lose your executive functioning capacity. These are the areas that are most sensitive actually to blood vascular degeneration, because these are the newest areas of our brain that have developed evolutionarily. And so what we can do in a chamber is we can regrow blood vessels in these areas that have deteriorated over time. Another area that's very, very sensitive to blood flow and to degeneration over time, because it's very plastic, which means it's always changing, is the hippocampus, which is an area in our brain that's responsible for storing our long-term memories and creating the ability to bring things from our short-term memory and bring it into our long-term memory, and vice versa. So getting things out of our long-term memory and bringing it into our short-term. And so if we can optimize blood flow to those areas, you can really optimize brain function. And so absolutely, there's a lot of different ways and strategies to increase blood vascularization, but this is a very fantastic way to do it. I mean, exercise does it too, right? I mean, getting yourself exercise. We also think cold and heat exposure can also increase vascularization as well. These are all ways to increase flow and optimize for sure.
Mm-hmm. And in your mind, Dr. Sherr, is creating new blood vessels, angiogenesis, does that go hand in hand with increased blood flow, or are those separate things that need to be handled differently?
No, they go hand in hand, right? So you need blood vessels to create blood flow. Mm-hmm. But you do that, you stimulate the blood vessels to grow with the various technologies and practices that I've just described.
Dr. Sherr, let's say somebody comes to you and they say, okay, let's look at my blood, let's look at my stool, let's look at my urine markers, and you take a look at all those, you look at their lifestyle, you look at what they're doing, and you say, okay, here's a program for you, right? Obviously, there's a lot of basic things in the program that you're going to help them with: stop smoking, sleep better, mm-hmm. do these, the almost free things, right? Exercise more. But then at some point, you're like, all right, here's your stack of biohacks, if you will. These are the things you should do. How does, there's so many options now in this new alternative world. How does somebody, obviously working with you, you'll help them prioritize, but if somebody's just listening to this podcast, how do they start to think about where do the puzzle pieces fit for me? What's first, what's second, what's third?
That's a really good question. I think a lot of it depends on the specific goals that they have and then the resources that are available to them. Like you said, there's free things that you can do. There's a lot of free things. There's not eating, right? There's doing intermittent fasting. Not eating is free. So you don't have to eat all the time. You can optimize your sleep. There's a lot of ways to do that without having a lot of technology or things that require a lot of money. You can optimize the kind of water that you're drinking and the kind of food that you're eating, making sure it's clean and making sure it's not pesticide ridden and that it's coming from good sources and all those kinds of things. And so that's sort of like although food's not free, those are the kinds of things that are sort of the things that are, food, shelter, water kinds of necessity things. I mean, the other thing, part of it that I also talk about that's free is the connection piece, making sure you have good relationships or maintaining relationships or creating relationships, finding your tribe, having a good relationship with yourself, so having meditative practices. Those are really important and don't cost a huge amount of money, and they have a lot of return on investment. I mean, I think the top, sort of like the more lonely you feel, the higher risk you have of dying, right? So that's what the happiness projects have talked about. So we want to not feel lonely. You don't have to be with people to not feel lonely, but you have to have a good relationship with yourself, etc. So those are the free things. And then I would like typically to take people through health optimization medicine, my practice, doing all the markers, optimizing health from the cellular level. And then once that's being done either in parallel or at the same time, which is the same, or afterwards, whatever, or then it's the question of what are the best technologies for their particular goals in my estimation. And so the things that I use a lot of, I would obviously, I think that the hyperbaric environment can be very, very awesome. And it could be doing that in a neurohacking optimization perspective, and they could be doing that in sort of like a full body systemic optimization perspective. But either way, these are not short protocols. These are protocols that are 20, 40, 60 treatments long. And usually done Monday through Friday with the weekends off, because hyperbaric therapy, getting all that oxygen in circulation, we're driving more oxygen into the body and it's creating that epigenetic shift. But that shift takes time and it takes that continuous oxygen exposure on the DNA to do it. And so there's different types of chambers. There's these mild-sided units. These are the ones that are in people's homes. They are in some clinics, but they're the portable chambers. These go to 1.3 atmospheres, and they can be used for like the neurocognitive optimization stuff. They can be used for muscle recovery, jet lag. They can be used as meditative spaces and sensory deprivation tanks. They can be used for mild stuff. But in general, for more systemic things, more full body optimization, this is really the hard chambers. And or you're using the soft chambers with other technologies that are helping with flow. So this is things like low-level light therapy and infrared sauna for detox, for example, or using it, supplements and other technologies and tools to help with oxygen flow, or getting more oxygen to tissue, more vascularization, more blood oxygen to the various areas to get more oxygen to them. So it depends on how you swing it. There's no one right way for everybody. But in general, my usual recommendations are the easy stuff, the health optimization medicine framework, which is a 7-pillar framework. If people can afford it and have the time, and it does take money to do, and then using these various biohacking, stacking technologies, supplements, tools, depending on what their needs are, and using them in a very personalized approach, depending on what all the other stuff showed, what all the data showed along the way.
Got it. So from an optimization standpoint, as you mentioned, there's many sessions that need to be done. I believe you said up to 40.
We're talking about like jet lag and like muscle recovery and neurocognitive optimization. You can do shorter numbers of sessions. It's just not going to last as long, especially from like a neurocognitive optimization perspective. But muscle recovery, just one session can do it. If you have jet lag, a couple of sessions will really make a significant difference. But for these long-term goals, you need long-term protocols, not just 1 or 2 treatments typically.
So there's the concept of doing it a lot in the beginning and then doing it once a week to kind of maintain for the rest of your life? Is somehow something that you look at it through this lens?
So for the optimization protocols, yes, in the sense that there's usually like a block of therapy that's recommended initially. And then after the block, it's more of a maintenance type of regimen, unless you have other issues that kind of pop up or other goals that kind of come to the surface that you want to address. For example, you've done an optimization protocol, you've done 40 treatments in a hard chamber, you're doing maintenance maybe in a mild sided unit, maybe 2 or 3 times a week or 4 times a month. But then you're like, well, Dr. Scott, I want to go and do an endurance race, or I have a test coming up and I need to optimize my brain function. Then you change the protocols as you go, depending. And so I have some very high net worth clients that have the hard chambers in their homes, and they use them in these blocks, and then they'll do maintenance, and then over time they'll change depending on what's needed. Others have the mild chambers in their homes, and we do just the mild chamber sessions and optimize as best we can with other technologies before and after, and even during. The nice thing about the mild chambers is that you can actually bring stuff into the chamber with you, because it's a low oxygen environment, a very low risk for anything from a health perspective or from a safety perspective.
Like you mean your iPhone to play a game of whatever on your phone?
Or you could bring in your neurofeedback device in, you could bring your low-level light therapy pads in. Yeah, you can do lots of interesting things.
Okay. How long does a session typically last?
Typically a session's between 60 and 90 minutes.
60 and 90 minutes. Okay. And I've got a couple of questions over the last couple of months in terms of cost. I know that costs are different in different areas of the country, but what's a typical cost for one session that somebody would expect to pay?
In a hard-sided unit, like a medical unit, those are the ones that we have all our FDA-approved indications, et cetera. You're looking somewhere between $175 to $325 per session, typically.
Got it. Okay.
Depending on where you are in the country and what kind of chamber you're in. In the mild-sided units, it could be anywhere between $75, $50 a session to maybe $150 a session, depending on where you are.
Okay. And are there any risks to doing this type of therapy?
Yeah. So you're under more pressure and you're getting more oxygen. So you have to make sure that your body is healthy enough to withstand the pressure and the oxygen. So you have to have normal lung function, normal pulmonary function in general. If you have any mild pulmonary stuff, it's typically okay, but it has to be done in a more careful way. So if you have controlled asthma, we've had patients in post-COVID that have respiratory stuff that have done fine, and I've had patients with radiation injury to their lungs and have done well at the same time, but you have to just be more careful in the chambers. You have to have normal heart function as well. So you have any uncontrolled heart issues, that could be an issue in the chamber, especially if you have a low functioning heart, which means you have like congestive heart failure, for example. So if you have congestive heart failure, it can be dangerous to go into the chamber. If you're pregnant, you're not supposed to go in, but we do put pregnant patients in the chambers that have carbon monoxide poisoning, and the babies do fine. If you have high fevers, if you have any genetic conditions that affect your lungs, if you have an uncontrolled seizure disorder, so at high oxygen amounts, you decrease your seizure threshold. You can actually mitigate that by using ketones in the chambers, actually. So in some patients, we're combining ketone esters or ketone salts, but the esters are better, we think, at preventing seizures in the chambers in people that are high risk if they have like a brain cancer, for example, like a glioblastoma, or if they've had a stroke or traumatic brain injury, or if they're just an optimizer that wants to improve overall blood flow and do the ketogenic thing. Ketone levels go up in the chamber as well, because the chambers have the ability to increase metabolic activity and increase insulin sensitivity. So your blood glucose will drop in the chamber. So that's nice for people that are ketogenic or fasting, their ketones will go up. If you're a diabetic, though, we have to be a little more careful. And so we have to watch blood sugars when you're in the chamber. Those are the major things. I like to say hyperbaric therapy is safer than taking an Advil, as long as you have a good screening process ahead of time to ensure that you're going to be safe in the chamber. It's a medical prescription required to get into a chamber, no matter what type of chamber you get into. So just please be aware of that. If you're looking to use the chamber, it really does require medical supervision. The challenge with my community is that there's lots of variability in what's out there in the clinics that you might go to. My personal practice is a worldwide virtual practice for the most part in hyperbaric therapy and in health optimization medicine for that matter. So I help provide consultation, education, advocacy for people so that when they're using the chambers, they can use them as effectively as possible. Like I said before, for us, like most of the conversation tends to be related to other things, and then hyperbaric therapy is sort of the end of the conversation. But in general, I know clinics around the country. I know places in LA, for example, and obviously in the Bay Area where I live, but all across the world where I can help coordinate and help with that ushering of understanding if the clinicians don't have a good baseline for this kind of work in a more integrative way.
Got it. So that's a good point, Dr. Scott. I wanted you to tell the audience how you work with them. You just mentioned that you could do some type of consultative approach, even if they're far away from you.
Right.
Can anybody in any part of the country call you and say, Dr. Scott, this is what I'm trying to do, and you will consult with them?
Yeah, I mean, it's consulting, it's education, it's advocacy. It just depends on the situation, but absolutely. I mean, that's one of the main things that I do. And I also work with clinics directly that are looking to set up optimization programs using various technologies, including hyperbarics. I work with individuals that run the gamut, high net worth to people that are just trying to get by day to day and just trying to optimize their health. Typically, the conversation involves hyperbaric medicine on some level, but also on the health optimization front as well. I'm doing all of that virtually as well.
That's great. So where can people find you online to consult with you or just learn more about you? So
Instagram is probably one of the main ways. My Instagram is at Dr. Scott Sherr, all spelled out, DrScottSherr. My hyperbaric website for integrative work related to hyperbaric medicine is integrativehbot.com. And I have a Facebook page that's similar to that. It's the same, just Integrative HBOT. I also have a hyperbaric technology company that's creating new technology. It's called HBOT Plus, which you can find in various socials. And for my health optimization medicine practice, it's home-sf.co, home-sf.co. And so, but you find me at one of those places, all of it kind of comes together. So, and happy to connect with people in any of those places. Or you could just Google my name and Dr. Scott Sherr and find a way to connect me with me that way too.
Yeah, that's cool. You're doing a lot of stuff, and I congratulate you for keeping this busy in interesting times like these.
Got to keep it interesting.
Yeah, you do. Dr. Scott, thank you so much for coming on the Anti-Aging Hacks Show. I really appreciate you.
It's been a pleasure for us. I hope this was helpful, and my pleasure. And until the next time.